One of the things that I'm able to do with advanced training that I've done is something called a TPLO procedure, and this is for correction and stabilization of a torn ACL. So in humans it's called an ACL, and in dogs it's called a CCL. And a lot of bigger dogs are prone to this sort of injury, one, because of their anatomy, and two, because of the high energy that they expel. We've all seen those dogs that are in the dog park or throwing the tennis balls, they're leaping up in the air, or they're running and sprinting in the dog park and they're pivoting very quickly. Well, you can see a lot of the same injuries that you'll see with football players or basketball players. And it's these injuries that tear that ligament or strain that ligament. And so one of the things that we're able to do is help to stabilize this joint. So in people, they put in implants of either a cadaver or from your own hamstring and basically create stability inside that joint. But in dogs, we don't have that capacity. So what we need to do is stabilize the joint by other means. And so what we'll do is, this is the dog that before surgery, and you can see the top of their shin bone, which is right here, has a very high degree of slope or an angle. That's at 27 degrees. And so that's causing chronic strain or chronic fatigue on that ligament. And so what we do is we clean out the joint, we take out the remnants of the damaged ACL, and then after that we try to stabilize the joint by flattening out that slope or that angle on the top of the shin bone. So we'll make a cut in the bone. You can see this semicircular line here, a cut underneath the bone, and then we'll rotate it, and then we'll fix it in place with a plate and screws. And so I'm going to shift the image. So this is the side view then of all the screws and the plate stabilizing that bone. And so what happens now is, instead of a dog walking on top of the top of a shin that's angled backwards and that is sliding off, now it's nice and flat, and it can step right on top of that flat surface, causing stability and a very, very high return to normal function. So this is just one of the really great procedures that we're able to do in our great facility here at University Animal Hospital.